Good morning and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health. You may wonder, who is Kaleida Health? Well, Kaleida Health, we are the hospitals including Buffalo General Medical Center, Oishei Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban Hospital, Visiting Nursing Association, which is our area of healthcare that comes to your home 24 hours a day, 7 days a week, and works with all ages. We also have DeGraff Medical Facility, and we have clinics throughout Buffalo. We have the Hurdle Elmwood Adult Clinic, our children's clinic, located on Niagara Street, besides the clinics that are a part of Gates Vascular Institute and the Conventus building. We also have a standalone clinic on Niagara Street. We have two women's health clinics, one on Kensington Avenue, as well as, again, Niagara Street. And we have two long-term care facilities, one in Buffalo, one in North Tonawanda. And also we have several school-based health clinics throughout different schools in Buffalo. In case you were wondering, Kaleida is now scheduling health events, health outreach. If you have any questions, if you'd like to make sure that we are part of your vendor tables, please give us a call at 716-863-8717. Again, that is 716-863-8717. We're also available for speaking engagements. And our speaking engagements, we can do both virtual and in person. Many of you have been inquiring lately about our tours, especially for high school students. And we definitely have tours available at our labs. There are a few requirements. However, the lab tours are up and running. And there's also a tour called Brain, that's your Brain Boot Camp. Brain Boot Camp is part of the Gates Vascular Institute. Again, if you have questions on speaking engagements, outreach, tours, again, please give a call at 716-863-8717. Did you know that at our Millard Fillmore Suburban Hospital, we have a new we have a renovated, not new, the mother baby unit has been there. However, we've had extensive renovations and it is beautiful. So if you're interested, if you're expecting and you're touring different sites, please, I would hope you would stop by and visit our mother baby unit at Millard Fillmore Suburban Hospital. And on that note, I'm just going to move into our show, because our show for today is one that impacts many of you, many people in your family. It may, who are currently in your family. It could impact your next door neighbor, and it could be something with blood work you're just not sure if you have. And what is that? Type 2 diabetes. And today's program, we're going to be talking with Jennifer Hojek. Good morning, Jennifer. How are you?
Good morning. I'm good. How are you?
Good. Did I pronounce your last name correctly?
It's Wojcik. Yep.
Wojcik. Okay. So Jennifer is a physician assistant. She is director of our survivorship program, and she works for one of our affiliates called General Physician. And today we are going to be talking about a few things: type 2 diabetes, wound care, which can come about through having diabetes, and healthy aging. So we're going to just start in the program right now. And Jennifer, could you just talk about with type 2 diabetes and through proper nutrition with type 2 diabetes, can one eliminate the disease from their system, meaning can one eliminate the type 2 diabetes through their system with proper nutrition? And just a little bit about what is type 2 diabetes.
Sure. So diabetes in general is defined as the impaired ability to use glucose. For your body to convert that sugar that it's taking in, and it results in elevated sugar levels. So there's two types of diabetes. Type 1 is an autoimmune condition, which really results from the body attacking its own cells in the pancreas, resulting in it not being able to use that sugar properly anymore. For type 2 diabetes, it's not an autoimmune condition. It can sometimes happen through changes in diet, the way that your cells respond to that glucose. Certain risk factors for type 2 diabetes include advancing age. If anyone had gestational diabetes or diabetes when they were pregnant, family history, obesity, sedentary lifestyle, things like that. The good thing about type 2 diabetes is it can be managed through proper nutrition. So it is possible to prevent progression of type 2 diabetes. So progressing from pre-diabetes to actual type 2 diabetes. And then when someone is diagnosed with type 2 diabetes, they can use their diet, sometimes in combination with medications, to really normalize their blood sugar and make sure that they're not experiencing any complications from those blood sugars being high.
Okay, a few questions from there. I know a lot of type 2 diabetics who obviously they must not be, and that's a part of the reason why you're the guest on our program today, type 2 diabetics whose glucose, which is also known as sugar, isn't regulated. I mean, it's not regulated. So how does one know what to eliminate from their diet if they're not getting the results that you're speaking of?
So when we're talking about nutrition, we look at what are called our 3 macronutrients, which all food is really broken down into. So things can be either a carbohydrate, a protein, or a fat. The big thing that causes blood sugars to rise are carbohydrates. So those are things like our grains, so our pasta, bread, rice, starchy vegetables like potatoes, corn, peas.
How about cereal, like just everyday morning cereal?
Yep, cereal is one of them. The milk that a lot of people put on cereal can also make blood sugars rise. Fruits, fruit juices, and any kind of added sugar. Anytime that you're putting sugar into anything, that's a carbohydrate as well.
Now, can an individual tell in their body? I've heard people say, "I think I have diabetes," and they haven't had any blood work. So, is there any way an individual can tell, or is it something they have to go for blood work?
So, it's something that can only be definitively diagnosed by blood work, or even a finger stick, checking a blood sugar through a finger stick with a glucometer. But there are certain symptoms that people can look out for, excessive thirst or excessive hunger, unexplained weight loss, excessive urination, and just generalized fatigue are all, common things of those blood sugars being high.
Mm-hmm. Okay. Thank you. To avoid diabetes, what type of a nutrition plan is recommended?
So in general, making sure that those 3 macronutrients are pretty even, keeping the carbohydrates on a lower level. I think that a good way to kind of make sure that your your meals are well balanced is to use the plate method. And that's when, if you're looking at your average meal plate, half of that plate should be non-starchy vegetables. 1/4 of that plate should be a lean protein, and then 1/4 of that plate can be your grains or your starchy vegetables. So that's a good kind of estimate of what should be included in a meal.
Well, lately I remember, like, when football time, it's football season, and you see these platters. There are plates, but they're like longer than a plate. They're larger than a plate. And I was going through the store the other day, walking through, and I saw they had Thanksgiving Day platter. So in terms of plates, it seems like plates are, even the paper ones, are becoming larger. So then what would you recommend if someone has that larger plate? It's longer, it can hold more food. What's recommended then that diabetic do then? Because it's not a typical plate size, it's larger.
Yeah, so definitely keep that in mind, especially as kind of everything is increasing in size. Trying to keep kind of your average dinner plate idea in size. The smaller plates that you use is actually a good way to kind of trick your brain into thinking that you're getting more. You know, if you have these smaller serving size on a big plate, it's going to seem like less. But if you can really, you know, load up a smaller plate, you know, it's going to kind of trick your brain into thinking that it's getting more.
Mm-hmm. But what should they do if they have that platter and there's no other option? So then how would they load up that plate?
Yeah, kind of trying to keep in consideration portion sizes. So looking at nutrition labels is always important, and actually looking at what that serving size is and making sure that you're not going above it. You know, keeping in mind, the more that you can also just kind of focus on your fruits and veggies, especially those veggies, the more that you can fill up on that, and keeping the protein and those carbohydrates to a lower level. As long as you're focusing on those healthy vegetables and really trying to fill up on that, that's going to be kind of at least a good place to start in terms of hoping to lower that blood sugar.
Now, something you mentioned vegetables. I'm noticing on a lot of menus, I'm seeing fried Brussels sprouts, fried cauliflower. Is a fried Brussels sprout or a fried cauliflower, is that better than eating a fried wing, or is it all bad?
I mean, I would say that it's better than eating a chicken wing, but anytime that we're frying anything, we're adding that unnecessary fat and just not a great cooking method. So if you can try and focus on roasting, baking, even using, you know, for an easy way, using a frozen vegetable and just putting it in the microwave, that's going to be a much better utilization of those vegetables without added calories and fat.
Okay. And I know the listeners are going to laugh at me, but what I've started doing in terms of, you know, when I look at it, when I'm eating, many times I'm now eating the salad last. I'm calling it my dessert. So everyone don't laugh at me. People are like, you're eating your dessert, your salad last. I'm like, no, this is my dessert. So, but it's taken a long time to get to that point where I can jokingly say that. Now, is diabetes genetic?
It can be. There's definitely a genetic predisposition. So for both type 1 and type 2 diabetes, that is something that if it runs in your family, you're at higher risk for developing that. But whereas type 1 diabetes is not really preventable, type 2 diabetes is. So if you do have that family history of diabetes, keeping that in mind that you are going to be at higher risk for potentially developing it, and making sure that you're, you know, having proper nutrition and a generally healthy lifestyle can help to prevent or at least delay the onset of diabetes.
Now, are type 2 diabetics, do they take insulin?
They can. So it's not a requirement. Sometimes people can just manage their diabetes with oral pills or even just with diet alone. But it can, you know, if it's not working with diet changes, with oral medications, they can use insulin as well.
Okay, and I just wondered about that. Let's just do a slight shift. I know diabetics are inclined to sometimes have wounds. Let's talk about wounds. WOUND. I want to make sure that our listeners have an understanding of what is a wound and how can nutrition aid in the healing of a wound. So, if you could speak on that, please.
Yeah, absolutely. So a wound is really any injury that occurs to the skin or the body. And this can happen from any mechanism, whether it's related to their diabetes or vascular disease, or they just had a cut or a sore. But when that happens, the body's immune system has to respond to help rebuild and heal that wound, which places increased nutritional demand on the body. So your nutritional needs are higher when you are trying to heal a wound. So that involves, we need calories to provide energy so that your body can use proteins to repair the wound. Proteins are made up of little building blocks called amino acids that the body then uses to repair these wounds. And there's a lot of different nutrients that play a role in wound care.
Mm-hmm.
Not only the calories, the protein, but also collagen, adequate fluids, vitamin B12, vitamin C, vitamin E, zinc, arginine, and glutamine are all really vital to helping heal wounds when they happen.
Mm-hmm. Are there those last two that you mentioned, the last two words you mentioned, what were those last two ones?
Arginine and glutamine. So those are certain amino acids that make up some of our proteins.
What are they found in?
So those are found in a variety of different foods. They're kind of difficult to target specifically, but having your foods that are high in protein can certainly help with that. So things like your lean protein, so chicken, lean pork chops, those can give you a high amount of protein in a smaller serving size. About 6 ounces of chicken breast has 54.5 grams of protein, which is great. You can even do plant-based proteins like lentils. Those give you almost 18 grams in a cup of lentils. Low-fat yogurt, that gives you 14 grams in a cup. So the more of those proteins that you're getting for healing wounds is really important.
You talk about yogurt. You mentioned yogurt. Is it flavored yogurt, like with the fruit and the syrup at the bottom, or is it just a plain yogurt or flavor or a yogurt without flavor? Does it matter what type of yogurt?
Yeah, so for sure, especially with yogurt, a lot of times people think that any kind of yogurt is a healthy choice.
Yes.
Unfortunately, you have to be really careful with some of them. Some of them are absolutely packed with added sugar. So as much as we like to have those, fruit in the bottoms with the mix-ins, sometimes those can have more sugar than like a candy bar. So really checking the labels. I don't think that you necessarily have to do completely plain yogurt, but really reading those labels and making sure that the sugar content isn't really high.
With a plain yogurt, though, can you add your own blueberries or strawberries to it for texture and flavor?
Yeah, absolutely. That's a great idea to add fresh fruit into the yogurt to give it some additional flavor rather than those are alternative, flavorings that are added.
Right. And I guess along that line, or even a frozen blueberry after it's thawed or however you would like to eat it, consume that. I'm sure that would be equally healthy to add to a plain yogurt.
Yeah, especially as we're going into winter in Buffalo and those fresh fruits and veggies aren't as readily available. Frozen is totally fine.
Yes. Now, a wound, you talked about a wound. A wound can start off, because sometimes you think a wound, you think of, you think of something that's like a large wound, something you can physically see. A wound for a diabetic, and you mentioned smaller things, like it might be your shoe that's rubbed the inside of your foot that can become infected. A wound in terms of wound care, it can start off small, right?
Yeah, absolutely. And that's why, especially if there's a history of diabetes, anytime that you notice anything, especially on the bottom of the feet or really anywhere, it is super important to have it evaluated by a medical professional, especially with wounds. Getting things looked at sooner rather than later can really help to expedite the healing process. Keeping in mind these nutritional changes is always a great idea, but you definitely need to have any sort of wound looked at by a medical professional.
And I would say if there's someone at your house who can even just do a quick glance at the bottom of your feet, if you're unable to see the bottom of your feet, because that's kind of an awkward position, you may not be able to bend over and feel it. You may not just be able to see it. If you just ask somebody else to, who can look at the bottoms of your feet and see if they see something unusual, would that be acceptable?
Yes, absolutely. It has to be at least regular that someone, if it's not yourself or at least someone in the house is looking at the bottom of the feet if you have diabetes. A lot of times we can have nerve damage with diabetes, and sometimes those people don't feel the bottom of their feet as well as they should. So they might even have a sore there without being able to feel it. So it's very important to inspect those feet regularly.
Mhm. Yeah, and I just want to add a real quick story about someone I knew once, or someone I heard about, who once had accidentally stepped on a staple and had no idea. They were diabetic, had no idea that they had diabetes. I mean, had no idea that the staple was in their foot. It caused all kinds of complications, but I'm glad to say that, the individual is fine. But they walked around for a few days not knowing that they had stepped on a staple.
Right.
Yeah, they were diabetic. How about healthy aging? Let's turn the corner. One more turn at our conversation. What is healthy aging?
So healthy aging is defined as the process of developing and maintaining the functional ability that enables well-being in older age. So how can we maintain our functional status, our quality of life as we get older? So some examples of unhealthy aging, sometimes it can manifest as decreased mobility, not being able to get around as well as we used to. Different chronic diseases, whether that be diabetes, heart disease, high blood pressure, mood disorders, anxiety, depression as you get older get more common, dementia, things like that.
And you mentioned that. I was reading something the other day talking about mood disorders, and it was even mentioning things such as sugar. So if you're eating a piece of candy, or if you're eating a piece of pie or something with sugar, it talked about that sugar bringing you way up, that sugar rush, and then crashing after the sugar is out of your system, and something like that could cause mood swings, right?
Absolutely. Especially if they have underlying diabetes, you're going to be more sensitive to that rapid rise in the blood sugar and then that subsequent fall in the blood sugar.
Mm-hmm. And then what would happen with that subsequent fall? Would that person take medication? What do you do?
I think that just kind of trying to aim for a more steady blood sugar, whether that is through diet changes or through medication. We certainly, no matter what, we don't want that blood sugar rapidly rising and then falling. We want to kind of keep it more steady, so the patients feel better in that aspect.
Mm-hmm. Mm-hmm. What, how can nutrition aid in promoting healthy aging?
So a healthy nutrition can provide, the life-sustaining nutrients that can prevent and treat chronic diseases, can improve quality of life and maintain functional status. So in general, our diets as Americans are lacking in veggies and whole grains and dairy, calcium, and I have an excess of sodium, saturated fats, sugar, and alcohol. So the more that we work on increasing our whole grains, our monounsaturated fats, which are healthy fats like avocados, nuts, seeds, olive oil, our lean proteins like chicken, fish, fiber, and our fresh fruits and vegetables, and working on really decreasing our processed foods, our added sugars, white breads and grains, added sodium and alcohol. That can all help to promote healthy aging.
Mm-hmm. How about, again, I go back to football season, a favorite of many a gathering, cheese, crackers, and pepperoni. How is that when it comes to healthy nutrition? Does that get an A, B, C, D, E, or F?
So I'm a big believer in all things in moderation. Everyone loves a good cheese platter, but certainly not something to be eaten in excess. The pepperoni is probably the biggest offender on there. It's just ultra processed fat that would be best avoided. And I mean, cheese is again a fat, all things in moderation, but I think that there are certainly healthier tailgating options, we'll say.
Mm-hmm. Well, I'm just thinking because I think we have a long football season ahead of us. So I'm just thinking of foods that people can. So what would you substitute? Seeing as we do, it looks like we're going to have this long season. What are some recommendations that you would have? Hummus, maybe, or
I think hummus is a great option. I know a lot of people are big fans of, different kinds of dips, and maybe instead of using crackers in the dips, you use some carrots and celery instead. And then just keeping in mind, even, a lot of times we think about, we'll bring a veggie tray for football games, keeping in mind that it's a veggie tray and not a dip tray, so that you're not using a whole ton of dip to veggie ratio. So really keep the emphasis on those veggies.
Now, how about fruit instead of how does fruit compare to vegetables as a dip? Meaning like carrots, celery, and red pepper, cucumbers versus apples and let's say pineapple in a dip. What would you say in terms of what's healthier than the other?
I think that always aiming for as many vegetables as you can is good. I think that fruits are still a great option. I think that recently with, the keto diet and everything coming out, fruits have gotten a little bit of a bad rap. But they're a carbohydrate, but they have a lot of fiber. They have a lot of necessary vitamins and nutrients in it. In terms of diabetes, you just have to be careful about the portion size and how much you're eating because it can cause your sugar to raise. But I still think that it's a much better option than a cracker or other types of carbs that might be substituted.
Okay, well, you know what, Jennifer, we are out of time, but I just want you to know that this is not our last conversation on diabetes, type 2 diabetes, because it is the rates are very high. Do you know that percentage?
If we're looking at over the age of 65, it actually goes up to 1 in 4. So 25% of people over the age of 65 have diabetes.
Thank you. And so with 25% of the population having diabetes over 65, knowing Western New York is an older population, this is not the last that you will hear on type 2 diabetes, and just providing an educational overview because this is a health show and we want to keep you and your loved ones and your neighbors healthy. So on that note, I want to say thank you, Jennifer from General Physicians. She's a physician assistant with the survivorship program, and she is the director of the survivorship program. So Jennifer, thank you so much for being our guest this morning on the Great Lakes Health.
Thank you so much for having me. I appreciate it.
You're welcome. And next week, you'll hear from my esteemed colleague from Erie County Medical Center, Cindy Bass, who will have another amazing educational topic along the lines of health. And 2 weeks, God be willing, you will hear me again. I'm Francesca Messiah from Kaleida Health. Please take good care of yourself and listen to some of the tips today that Jennifer has shared with you. Again, thank you for listening to our program and be safe. Bye-bye.